Assalamualaikum and welcome to another video of Learn with Laraib. Today we will be discussing basal ganglia. It is an important topic. However, most of the people confuse its functions and the pathways. So the main function of basal ganglia is to help in smooth execution of voluntary movements as well as suppression of unwanted movements. It is also involved in adjusting the posture. The other part of brain helping in posture is cerebellum. So basal ganglia basically influences the motor signals to the thalamus. So the signals going from the cortex to the body via thalamus, they're influenced by basal ganglia and refined. So we know the basic function of basal ganglia. Let's move on to the components of basal ganglia. Before we start with basal ganglia, I would like to tell you this is the lateral ventricle and this is the third ventricle. So this is a cross section of brain. Now to the components, this one over here is the caudate nucleus. This over here under the caudate is the thalamus. Now coming to the pyramidal shape structure, the outer one is putamen. The inner two are globus pallidus. The outer one is globus pallidus externe and the inner one is globus pallidus interne. Now the one present over here in pink along the third ventricle, that is the subthalamus. The one in white, that is Substantia nigra, which plays an important role in Parkinson's disease. I've heard of other terms such as striatum, lentiform nucleus. What are these? So striatum is caudate and putamen together. This is called striatum. Lentiform, on the other hand, is putamen and globus pallidus together. You might come across these terms, so you should know what they actually mean. Now, since we know the components of basal ganglia, which are caudate, putamen, globus pallidus, subthalamus, and substantia nigra, we will move on to the pathways. So it has two pathways, direct and indirect pathway. First of all, we'll discuss what is going on. So initially, the signal comes from cortex through the striatum via glutamate. Now, glutamate is an excitatory neuron, so it will excite the striatum. Now, the striatum will send signal to the globus pallidus, which is already sending an inhibitory signal to the thalamus, basically inhibiting the going signal for the motor area. Now, what happens is कि अब normally तो glutamate ने striatum को excite किया, उसने globus pallidus को signal दिया, जो कि जिसका काम globus pallidus का काम है कि वो thalamus को inhibit करेगा. However, over here, striatum will signal globus pallidus via GABA, which is an inhibitory neuron. So it will inhibit the function of globus pallidus or the pathway globus pallidus is sending to the thalamus. Once this is inhibited, the globus pallidus, the inhibitory function है, वो खत्म हो जाएगा. So when that is over, the thalamus will be able to send its signals to the motor area. So basically, the GABA neurons over here, they inhibit the inhibitory pathway. This is quite confusing. I hope you were able to understand this. Now coming to the indirect pathway. So the cortex again will send signals to striatum for its activation via glutamate. It excites. The striatum now sends signals to globus pallidus. The one involved over here was internal segment. The one involved in indirect pathway is the external segment. Now this one over here will also give subthalamic nuclei GABA signals. So this means that it is sending inhibitory signals. Now when it sends signals to subthalamic nuclei, it will excite via glutamate. Now over here, differentiate. Over here, the striatum was inhibiting the globus pallidus, but the subthalamic nuclei will excite the globus pallidus. Now once it excites the globus pallidus, let's do this in yellow. So once it excites the globus pallidus, the function of globus pallidus to inhibit thalamus will not be now inhibited. So subthalamic nuclei will excite globus pallidus and it will give it a go-ahead to go ahead and inhibit thalamus. Therefore, it will suppress the pathway and it will suppress the movement. So it suppresses the unwanted movement. This is via the indirect pathway. I hope you were able to understand. I'll just go through it once again just for a little clarification. Cortex is the one sending basic motor signals and it will excite the striatum. Striatum consists of caudate and putamen, which will then send indirect pathway inhibitory to globus pallidus. So basically, this is where the actual things carries out. So when striatum will send inhibitory, it will inhibit the function of globus pallidus, which is to inhibit thalamus. अब inhibitory function inhibit हो गया, that means thalamus will work. Now, on the other hand, in the indirect pathway, the subthalamic nuclei will excite the globus pallidus. They will not inhibit it from its function. So, it will carry out its function, which is inhibiting the thalamus. So, basically suppressing unwanted needs. Now, what role does Substantia nigra plays in whole of this process? So Substantia nigra has dopaminergic neurons and it secretes dopamine. The D1 receptors are present in the direct pathway, which are excitatory, and the D2 receptors are in the indirect pathway, which are inhibitory, basically inhibiting the function of the globus pallidus. So D1 will then excite the cortex. So in case there is no dopamine, the cortex will not be excited and the direct pathway will not work. The D2 inhibits the indirect pathway. So this one will excite the pathway. That means it is promoting what? Movement. Now the D2 will inhibit this pathway, the indirect pathway, again, which means that it is inhibiting this inhibition and therefore promoting movement. So dopamine will always promote movement by exciting the direct pathway and inhibiting the indirect pathway. Now, I hope you're not confused about the pathways, so we will move on to the lesions. So in case where the basal ganglia activity is increased, when the basal ganglia activity is increased, it means that the indirect pathway is working more than the direct pathway. That means that there is a suppression of unwanted movement. And this will lead to a disease known as Parkinson's disease. What happens is that there is a loss of dopamine. As I just told you, dopamine promotes movement via its excitatory and inhibitory function. So there will be a loss of dopamine, indirect inhibit nahi hoga, there will be more action of indirect, and hence there will be less movement, there will be movement suppression. That is why you see all the symptoms of Parkinson's disease, which are resting tremor, kinesia, that means less movement, and shuffling gait, also the rigidity. All right. Now moving on to where the basal ganglia control will decrease instead of increasing. So when the basal ganglia control decreases, that means that the direct pathways will work more than the indirect pathway. So there will be less movement suppression and more movement, which will lead to hyperkinetic disorders, one of which is Huntington's disease. So in Huntington's disease, there is a loss of striatal neurons. Now, what were they? They were the neurons present in the caudate and putamen. There will be a loss of striatal pathway in the indirect pathway first. So that is why direct will work more. So if there is a loss and inhibition of the inhibitory pathway, this one will be as loss in Huntington's disease. When there is a loss, there will be less suppression, and in turn, the direct pathway is working perfectly. Therefore, the movement will increase. So this is due to decreased release of GABA in the striatal pathway of the indirect pathway in basal ganglia. As the disease progresses, however, the direct pathway neurons also die, and it eventually leads to a late-stage hypokinesia as well. So for now, the Huntington's disease, the main feature is chorea, which is rapid, irregular, purposeless, non-rhythmic, jerky, involuntary movement. All of those words, jerky and like uncontrolled movement, a lot of movement, is a significant feature of Huntington's disease and is related with striatal pathway. That means caudate and putamen. Now, another disease, which is Hemiballismus, this is associated with subthalamic nuclei. Again, subthalamic nuclei were part of indirect pathway, and this will be destroyed. This is majorly when there is a stroke, and it is typically unilateral. It will result in wild flinging movements. All right, now let's discuss some important lesion sites and their results. So if there is a lesion in caudate nucleus, it will cause chorea, which, as we discussed in Huntington's disease, it will also be due to a lesion in putamen, but primarily in the caudate. In putamen, it will result in acetosis. Acetosis is slow breathing movement, which is commonly seen in Wilson's disease, and it is associated mainly with the lentiform nucleus. As we said, lentiform consists of putamen and globus pallidus. The globus pallidus, in turn, now when there's a lesion in that, it will result in dystonia and rigidity. Now, these points are important for the MCQs. There are one-liner MCQs asking about it. the lesion will decrease inhibition and sustained muscle contraction will lead to dystonia or rigidity. Now, lesion in substantia nigra pars compacta will lead to Parkinsonism, as we just discussed. Due to dopamine loss, there will be hypokinetic lesions causing bradykinesia, resting tremors, and rigidity. In subthalamic nuclei, as I just mentioned, will cause hemiballismus, which is usually unilateral but at the contralateral side. Now, if you see a movement disorder such as truncal ataxia, please remember that this is relevant to the cerebellar ramus, not the basal ganglia. You can see my video on cerebellum for this. Now, if you see a tremor, it can be related to cerebellum or it can be related to thalamus, but they are not related to basal ganglia. I hope you were able to understand what basal ganglia is and you will now face no problem in solving such questions. Please subscribe to my channel. Thank you.